Finding a balance between the control of life-threatening narcotics and providing compassionate care to the sick is, in many countries, complicated. This global health crisis leaves an estimated 80% of the world's population with little or no access to pain medication. Our story takes us to Indonesia in Southeast Asia to share one couple's struggle for pain relief. Flying into Indonesia, visitors receive a stark reminder of how seriously the war on illegal drugs is taken here.
We would like to remind you that carrying narcotics and drugs is violation of the law. Heavy penalties are imposed for disregarding the law. Thank you.
But Indonesia and many other countries' heavy penalties for illegal narcotics could be a contributing factor to why people who are sick and need legal drugs like morphine are too often not prescribed anything to relieve their pain.
I leave every morning at 5 a.m. to get here early. Later, I'll go back to bring my wife.
Every day, Johannes walks to the Sanjito Hospital in Yogyakarta, Indonesia, to save a place in line for his wife Rukila, who's undergoing radiation therapy. It's a journey that began a year earlier when Rukila was first diagnosed with breast cancer.
The last time the pain came back, my breast was swollen and blistered, and my body was really, really hot. It was unbearable. It was so painful, I couldn't wear clothes. Only if people were around would I cover myself.
During 2 months of testing, first at a public clinic and then at a public hospital, Rukila was not given anything to treat her pain. While pain treatment is her right, doctors were reluctant to administer pain medication. It's a reluctance seemingly shared by many doctors, and not only in Indonesia. The World Health Organization estimates that every year 5.5 million people with terminal cancer and another million with HIV/AIDS will die in pain without any pain medication at all.
I made her go to a hospital where she was admitted for 4 days. They told us that it was stage 4 breast cancer and that they couldn't treat her there.
Finally, when Johannes took Rukila to an expensive private hospital, she was given an IV of morphine to treat her pain.
When she was on the medication, the pain decreased. But when it wore off, we had to keep fanning her.
But why did it take so long for Rukila to get pain medication? Medication already on the Indonesian government's own list of essential medicines. It's a question posed by Dr. Lucas Meliala, president of the Indonesian Pain Association.
Why don't they use morphine? I really don't know. Morphine is easy to administer and it's inexpensive. But the reality is that few doctors are brave enough to prescribe it.
Tapi kenyataannya jarang sekali dokter yang marani meresepkan itu.
Not brave enough, perhaps, because of the deeply ingrained negative perceptions of morphine in Indonesia. In the past, drug abusers were sometimes referred to as morphinists, incorrectly confusing those who take morphine with those who take illegal narcotics like heroin. Both morphine and heroin are from the same group of drugs known as opioids, which are the byproducts of the poppy. But heroin, which offers no analgesic effect to reduce pain, is illegal in most countries in the world, including Indonesia, and is responsible for destroying millions of lives. And eliminating heroin is the focus of the global war on drugs, as seen in this footage from Afghanistan. In Indonesia, some feel that healthcare providers lack education on morphine and clear guidelines to allow them to confidently prescribe the drug for their patients.
We rarely prescribe morphine. We can prescribe it, but we don't have a system to monitor how it will be administered.
Dr. Chaya Punama directs a public health department and is concerned that the lack of clear guidelines for doctors is limiting patients' access to the drug.
In the Department of Health, these kinds of medications are not prescribed in the public clinics, but in other places. As doctors, we can prescribe morphine, and patients want us to give it to them. But there is a lot of risk, since we don't know a lot about palliative care.
And without clear guidelines and knowledge about how to treat patients at the local level, doctors just refer patients up the healthcare chain without treating their pain. Those who can't afford private treatment are left to suffer.
The prescriber should be convinced that they are in a good system, so they feel secure when they are prescribing morphine.
Dr. Sri Suryawati is an expert on essential medicines for the International Narcotics Control Board, the INCB.
And morphine and pethidine, etc., is very important and considered as essential for pain management at terminal ill. They provide the best clinical efficacy, the best safety status. They are affordable, they are available in the country, and they are in a good quality ensured by the government.
These standards are backed by the international community. Alongside 183 other countries, Indonesia is a signatory to the United Nations 1961 Single Convention on Narcotic Drugs, which established a framework to fight the illegal drug trade. But the 1961 convention also requires governments to ensure the availability of opioids for medical purposes for everyone, rich or poor.
The most important thing we can do is to provide better education on pain management in Indonesia. Doctors need to know that they should not be afraid to prescribe morphine.
The work of Dr. Meliala and others in Indonesia is beginning to pay off. The legal, safe use of morphine is on the rise in Indonesia, but there is still a long journey ahead. While Indonesia, like so many other countries, works to find its balance between narcotic control and availability, patients and their families, in the fight for their lives, will continue their struggle to find pain relief.
Since we got married, since we met for the first time, we've always been together. And now that she is sick, I will always be by her side.
He has been so good to me through this whole thing. He's given me so much love. There's nothing I can really say.
The road to recovery is never certain. Due to complications, Rukila passed away shortly after we filmed this report. Recently, Indonesia started to include pain management in medical school curricula. And in 2014, the government will roll out a 5-year universal healthcare reform plan, which will promote the provision of compassionate care for everyone.